to another episode. Hello, hello, hello. How you doing? You didn't give up yet, huh? All right, listen. I have an amazing testimony video right now. Shireen, and oh my God, she never quit on her dreams. She never gave up. It doesn't matter how long it took. She never gave up. She kept pursuing her dreams. And oh my God, listen to her story. Maybe you'll get a glimpse of her story, but I lived that story for 8 weeks. And I got so hooked to Shireen. She is an amazing mom. She's an amazing nurse. And I bet she's excelling in her nursing career. So let's listen to Shireen, and we'll come right back.
Hi everyone, my name is Shireen. I'm from the Philippines. I graduated nursing in 2003 and I worked in the operating room for almost 10 years. And then I got married and I decided to have kids first. And now I have 2 girls, 5 and 2-year-olds. So I decided that I'm gonna start working again after 7 years. So I purchased UWorld and used it and took NCLEX, and I took 192 questions and failed, but it was devastating. And then one day I was on YouTube and I found Mo's video, and then I gave it a thought and I decided I'll purchase the 4-week course. And I feel that it really helped me because I feel like it gives the bullet points of what to study. And I scheduled my NCLEX for April 29, but they unscheduled it, and then I found a slot for April 9, and I just closed my eyes and booked my test, even though I've been only studying like religiously for the last 3 weeks before that. But I have a gut feeling that I will pass, because after the 4-week course, Mo gave us NCLEX store, and there's like practice question that you should do, and at the bottom it's always says like you already passed NCLEX but you don't know it yet, you know. So I just trusted him so much. Him and Joe, they're always there when you ask them something. And yeah, I took 130 questions. I feel like I deserve that because I didn't really pay attention to the first 10 questions. So I think the first 10 questions really matters. And on April 10, I got an email from Oregon Board of Nursing, and they said that I have my license already and now I'm RN. I'm so happy. It took me like a week to do this video because I'm still over the moon. And I just can't thank Mo and Joe enough. Now I have a license. So guys, I highly recommend this course. If you take it really serious and you put everything to it, you will pass. Good luck!
Hey, all right, listen. I hope you enjoyed Shireen and her testimony and got inspired a little bit to at least push through the next few episodes, because she is amazing and you are as well. All right, let's move to the first question. But hey, listen, first I would like to welcome you to the self-paced virtual trainer. And trust me when I say, and I say it on every single episode, this is the ultimate algorithm to pass your NCLEX on your very next attempt. I have no doubt in my heart that you are already an NCLEX passer. Trust me, it already happened in the future. It's just a matter of time. Next time you're gonna take your NCLEX, you will be on this wall of testimony. I'm telling you, I know it in my heart that you are an NCLEX passer, and I don't want you to think any less of yourself. I want you to be confident that with this program you will pass your NCLEX. All you have to do is put in the work and show up every single day. Be consistent with your studies because you're no different than anyone on this slide. And your place is right on this wall. Listen, the road to become an Alpha Slice is not easy. It's bumpy. I say it every single time, and I want to remind you. All of us got obstacles on a daily basis. What do we do about them? We overcome those obstacles. We find solutions. You don't have a babysitter? Figure it out. You don't have the time to study today? Figure it out. You're sick today? Just figure it out. Your kids are fussy? Figure it out. You have to cook for your husband? Just figure it out. I'm telling you, just make it happen on a daily basis. Just try to overcome all your obstacles. Listen, I would like to welcome you to the Alpha Slice family because guess what? You are my family. Let's kick it with the first question. Now this is a very interesting question about blood transfusion, and we're gonna talk a little bit about hypersensitivity, transfusion reactions, and anaphylactic shock. While administering blood for a patient, which action will the nurse take to maintain safety? All right, listen, the subject of this question is very small, so it's gonna be easy to pick up keywords. The first keyword is administering blood. And then which action will the nurse take to maintain safety? Listen, safety is another keyword. Safety is a buzzword. And if I want to rephrase this question, I'm transfusing blood and I want to maintain safety. So what are the signs and symptoms that I need to pay attention for to make sure that the patient is not having any hypersensitivity, any allergic reaction or transfusion reaction, or, God forbid, anaphylactic shock? Again, select all that apply. I'm going to treat them as true or false. Number 1, verify patient's identification with at least 2 identifiers. Yes, of course, I need to have proper identification whenever I'm giving medication or blood transfusion. So I need at least 2 identifiers. I need a full name and date of birth, or MRN, which is a medical record number. And listen, some of my students, ask me, hey Mo, what if I had 2 patients in the same room with the same full name? What do? I need to check date of birth. What if they had the same date of birth? Right? Medical record number. Medical record number, there's no way that 2 patients will have the same medical record number. But again, remember, the NCLEX is not going to trick you those kind of tricks. It's not. They just want to make sure that you are a safe nurse who's going to check at least 2 identifiers, all right? So yes, I'm going to keep this first option because at the end of the day, you don't want to give the wrong blood to the wrong person. Number 2, give the blood unit as soon as it arrives on the unit. Yes, so with this option, I'm not sure why a lot of my students get confused. They start texting me or text their coach, hey, what do you think of this option? I don't think it's right. But listen, just imagine yourself, you are transfusing blood. If you send someone to the blood bank to get a blood unit, or you went to the blood bank to get a blood unit, you want to give it as soon as you get to the unit. Usually the guidelines are within the first 30 minutes from the blood unit leaving the blood bank. That's why we say as soon as it arrives to the unit. But if I'm a nurse and I want to administer or transfuse blood, first I want to make sure that everything is in place before I even ask for the blood unit. So I want to make sure that the order is right, the blood group is right, the typing and cross-matching are done. I want to make sure that the patient is afebrile. I want to check vital signs, and then I'll ask for the blood unit, okay? So that's what we mean by this option. Option number 3, administer the blood unit within 2 hours for increased benefit. No, you do not administer a blood unit within 2 hours. For example, am I going to give a blood unit over like an hour and a half, 90 minutes? Of course not. That will put the patient at risk for fluid overload because the blood unit is dense. I cannot give it that quick. So what I would do, or the guidelines are 2 to 4 hours. I usually go like for 3 or 3.5 hours, but you can utilize the whole 4 hours to transfuse 1 unit of blood. And you don't want to give blood that fast and put the patient at risk to have hypersensitivity or allergic reaction or, anaphylactic shock. So this option is a no-go. Number 4, during the first 15 minutes, stay with the patient. Yes, this is 100% right. If I'm transfusing blood unit in the patient room, so I'm gonna sit right there, grab a chair, sit at the bedside, check the patient identifiers, and then start transfusing the blood. While transfusing the blood, I'm talking to the patient and make sure he is with me. And then every 5 minutes, I'm gonna check vital signs. There are other symptoms that I'm gonna check, I'm gonna talk about in the other slide, but I need to check vital signs every 5 minutes for the first 15 minutes, and I don't leave the patient room, and I don't leave the patient out of my eyesight. I'm always looking at him, monitoring if they are having any hypersensitivity or allergic reaction. So always make sure, this is very serious, make sure that you are sitting there in the patient room, grab a chair, relax, just talk with the patient, and make sure you are monitoring those side effects. Number 5, get a PRN order for 1 to 2 liters of oxygen during the transfusion time. This is a wrong order. I don't take PRN orders for oxygen. It's either an order or not. If the patient is having desaturation, I need to figure out why, right? But I don't put PRN orders for oxygen, and it's not routinely administered with blood transfusions. So I'm not gonna select this option. So my options that I already selected are 1, 2, and 4. All right, now we're gonna talk a little bit about blood transfusion. How do you do it? What's the nursing care? A little bit about transfusion reactions, and most importantly, anaphylactic shock. All right, let's start with blood product transfusion. Obtain venous access. You can use central venous catheter or 20 gauge IV cannula. Now listen, those are the guidelines, but you can still transfuse blood on a 22 gauge cannula, the blue one, right? Always try to use or transfuse blood in an antecubital vein. And of course, if you have a patient with central venous catheter or implantable, venous access device, then that is amazing. All right? Use only blood administration tubing. So it is very important not to use a regular IV tubing, right? There's a specific tubing set for blood transfusion. Run blood products with saline solutions only. Anything else might induce hemolysis. Hemolysis is destruction of the cells, usually the RBCs, is destruction of those RBCs. Stay with the patient for the first 15 minutes. Monitor vital signs every 5 minutes for the first 15 minutes. The blood unit should be administered within 30 minutes of leaving the blood bank. Check vital signs before transfusion, during, immediately after, and then 1 hour post-transfusion. Transfuse the packed RBCs over 2 to 4 hours. Usually platelets, you can transfuse it anywhere from 30 minutes to 60 minutes. Now, what is the nursing plan during transfusion reaction? First, you need to stop the transfusion immediately. Change tubing, then continue IV saline. Examine the blood to determine if the patient was the intended recipient, and make sure that there's no error that happened there, and then send the unit back to the blood bank for testing. Treat for shock if present. And here we're talking about anaphylactic shock. I'm going to discuss it in details in a bit. But treatment in terms of oxygen, airway, subcutaneous, atropine, antipyretics, antihistamine, diuretics, and CPR if needed. Support the airway and circulation as necessary. Draw blood samples for serologic testing for antibodies. Monitor hourly urine output. Monitor vital signs with SpO2. Monitor vital signs every 5 minutes until stable. And of course, you need to notify the blood bank immediately as soon as a transfusion reaction happens. So now let's talk a little bit about types of transfusion reactions. We're gonna start with acute hemolysis. Signs and symptoms are chills, fever, low back pain, flushing, tachycardia, hypotension progressing to acute renal failure, shock, and lastly, it can lead to cardiac arrest. Now, febrile non-hemolytic transfusion reactions, and those are the most popular, we call it maybe hypersensitivity to blood transfusion, and those signs and symptoms are sudden chills and fever, headaches, flushing, anxiety, and muscle pain. And usually with those type of reaction, you immediately stop the transfusion, maybe give antipyretic, wait 10 to 15 minutes, monitor the patient if those symptoms are subsiding, and then start the transfusion back at a lower rate, and make sure you are monitoring the patient. If the patient has those symptoms again, maybe you need to talk to your physician and get a stop transfusion order. Another transfusion reaction is mild allergic reaction. Those patients will have symptoms of flushing, itching, and urticaria or hives. Usually with this kind of reaction, you don't stop transfusion, but sometimes you give antihistamine and make sure that the patient is not itching and the hives are subsiding. If the hives got severe, then you stop the transfusion. Again, wait for 10 to 15 minutes, make sure that everything subsides, and then start at the lower rate. If they happen again, you stop the transfusion, inform your provider, and ask or maybe recommend a stop transfusion order. And lastly, which is the most important transfusion reaction, is anaphylactic or severe allergic reaction. And those could be accompanied by signs and symptoms like anxiety, urticaria, wheezing, progressive cyanosis leading to shock, and possible cardiac arrest. So with the first type of reaction, the acute hemolytic transfusion reaction, you stop infusion immediately, inform your provider, and follow the steps that we mentioned in the previous slide. And also with anaphylactic transfusion reaction, you stop the infusion immediately and you follow the steps that we discussed in the previous slide. Now let's talk a little bit about anaphylactic reaction. It is a serious allergic reaction with a rapid and acute onset. Signs and symptoms are itchy rash, throat or tongue swelling, shortness of breath, vomiting, lightheadedness, and low blood pressure. Treatment is adrenaline and subcutaneous atropine if respiratory symptoms are accompanied, like shortness of breath or wheezing. Supportive measures are to establish airway, high flow oxygen, IV fluids, antihistamine, and hydrocortisone for the throat and tongue swelling, and maybe laryngeal edema. My students get a little bit confused with hives and rash. So here is a visual difference with a couple of pictures. Hives look like this, while rash look like this. Now, laryngeal edema or throat or tongue swelling is a very serious complication which can really jeopardize the patient's breathing and can cause arrest. And this is a very serious picture of one of the patients, and this is a pediatric patient where he starts showing signs of swelling. So you really need to pay attention to those. And if a patient is at home, and let us say he had anaphylactic shock from some other thing not related to blood transfusion, then they need to have an EpiPen or epinephrine pen on hand to treat it immediately.
Yes. Episode number 9. Oh my God, listen, I cannot help myself but to be enthusiastic about the program. Am I the only one? Oh my God, yeah, I know it's my baby, and I know I tried to tailor it towards you. So listen, if you have any comments, please put it in the discussion. I read all those comments, and we improve the course accordingly. But listen, I would like to ask you a question before we move on, because we discussed a very important topic on the NCLEX and in real life, which is blood transfusion. Listen, I'm gonna ask you a question. Which of the following you need to stop the transfusion right away? You've got febrile non-hemolytic reaction, acute hemolytic reaction, or mild allergic reaction. What do you think is the right answer? Yes, you are 100% right. Listen, blood transfusion is very, very important, especially reactions and, most importantly, anaphylactic reaction. Listen, I didn't talk about anaphylactic reaction in this particular question, but you need to review it as well. But you got the right answer. It's acute hemolytic reaction. I need to stop the transfusion right away and then follow the steps that we discussed in the slides, all right? Let's move on and continue this episode.
Alright, let's see this question. The nurse provides care for a patient diagnosed with neonatal abstinence syndrome. The newborn is having drug withdrawal symptoms. What nursing intervention would the nurse include in the plan of care? So let's read the question again and highlight keywords. So definitely whatever disease or symptoms in the question, those are going to be my keyword. The nurse provides care for a patient diagnosed with neonatal abstinence syndrome. So neonatal abstinence syndrome is a keyword. Newborn is having drug withdrawal symptoms. Again, drug withdrawal symptoms is a keyword. Now, I'm looking for interventions that the nurse can include in the plan of care. Select all that apply. All right. Listen, very important question. If I want to rephrase this question in my own word, I visualize myself in a neonatal intensive care unit. or maybe in nursery, in hospital setting, right? So I have a patient with neonatal abstinence syndrome. I would visualize myself. This patient is having drug withdrawal symptoms. What are the interventions that I need to do to make sure that that patient is comfortable? All right? So I'm looking for interventions that the nurse can do to make sure that that patient with withdrawal symptoms is comfy. I don't want to disturb them. All right, so let's read the options, treat it as true or false, and then we're going to talk about neonatal abstinence syndrome. Option number 1, swaddle the newborn in a flexed position. All right, usually newborns from their own movement, those movements can cause startling or awakening or agitation. So putting the patient in a flexed position and maybe having a wrap swaddling them will decrease those movements, especially during feeding and sleeping. So I'm gonna keep this option. Option number 2, maintaining the newborn in a prone position. Listen, newborns or any infant, any baby under the age of 1 year old, you do not leave them prone position unattended. Sometimes you put them prone position if they're agitated or fussy, or maybe they're having some colic, and then you tap on their back, that's fine. But you don't put the patient in a prone position and let them sleep, because that might induce or might cause sudden infant death syndrome. So I'm gonna eliminate this option. Option number 3, frequently feed the newborn a high calorie formula. All right, I'm not gonna select this option just because of the word frequently. You know, those type of patients, you want them to rest. If they don't need to eat or to be fed, then don't feed them, let them sleep. If they wake up and they're crying, they wanna eat, they're hungry, then yes, definitely feed them. So the word frequently in this option is something that I didn't like, and I'm gonna cancel this option. Number 4, station the newborn in a quiet area on the unit. Yes, usually those patients are easily overstimulated by noise and activity, and I wanna keep them comfortable. So I choose the farthest, most quiet corner in the nursery or in the ICU, and I just put them there, and I don't wanna disturb them. Option number 5, dimmed light around newborn's crib provides a more peaceful environment. Yes, I'm gonna choose this option because usually you turn off the lights for those patients, especially above their crib, and sometimes you put a blanket on their crib just to make it more dark, more quiet. So yes, I'm gonna choose this option. So the options I choose for this question are 1, 4, and 5. Now let's talk a little bit about neonatal abstinence syndrome. A brief definition is, a neonatal abstinence syndrome is a term for a group of problems a baby experiences when withdrawing from exposure to narcotics. So this happens because the mother is addicted to drugs, and at birth, the baby's dependence on those drugs continues. So if they are no longer available, the baby will start having or experiencing signs of withdrawals. Usually signs of withdrawals or withdrawal symptoms start appearing 24 to 48 hours after birth. But sometimes they can appear 10 days, as long as 10 days after birth. So what are some of those drugs? Those can be opiates such as heroin and methadone, cocaine, amphetamines and barbiturates, morphine, hydrocodone, oxycodone, codeine, and tramadol. What are some of the concerns? Poor intrauterine growth, especially with cocaine. Premature birth, especially with amphetamines. Seizures, which can last up to 4 to 6 months. Low birth weight, especially with marijuana users. Birth defects. Signs of drug withdrawal are tremors, irritability or excessive crying, sleeping problems, high-pitched crying, tight muscle tone, hyperactive reflexes, seizures, yawning, stuffy nose, sneezing all the time, poor feeding and sucking, vomiting, diarrhea, dehydration, sweating, and fever. All right, let's read this question. What potential long-term effects of fetal alcohol syndrome does the nurse include in the teaching for pregnant women about alcohol consumption during pregnancy? Select all that apply. Let's read the question again and pick up keywords. What potential long-term effects of fetal alcohol syndrome? Listen, long-term effects is very important because that's what I'm looking for. I'm not looking for short-term, I'm looking for long-term effects. And then, as I said, whenever you've got a disease in the question, that is a keyword. So fetal alcohol syndrome is a keyword. So what does the nurse include in the teaching for pregnant women about alcohol consumption during pregnancy? Listen, this should be easy by now, all right? Rephrasing the question in your own words, in your mind, should be easy. So if I want to rephrase this question, I've got a pregnant woman and she drinks. And I want to tell her, as a nurse, I want to teach her what are the long-term effects of fetal alcohol syndrome, right? Easy. Right, let's read the options and figure out what is the right answer. Again, select all that apply. I'm going to treat it as true or false. And I want to make sure, try my best to eliminate or keep from the first time, all right? So let's see. Number 1, delayed physical growth. Is this a potential long-term effect of fetal alcohol syndrome? And listen, a lot of my students get a little bit confused or distracted. I'm not sure what the terminology is, but when it comes to fetal alcohol syndrome, it's different from neonatal abstinence syndrome. Neonatal abstinence syndrome is drug abuse, all right? Drugs. Fetal alcohol syndrome is alcohol, all right? So don't get distracted or confused. So listen, option number 1, delayed physical growth. Yes, it is part of potential long-term effects of fetal alcohol syndrome. Option number 2, facial deformities. That is also true. It is a long-term potential effect of FAS, which is fetal alcohol syndrome. Then you've got number 3, respiratory depression. Respiratory depression is not part of fetal alcohol syndrome, but it is part of neonatal abstinence syndrome, all right? So don't confuse the two. And then you've got option number 4, learning disabilities. Yes, this is part of long-term effects of fetal alcohol syndrome. And number 5, hypotension. And again, hypotension is part of signs and symptoms of neonatal abstinence syndrome, but not fetal alcohol syndrome. So the right options are 1, 2, and 4. And let me show you this slide, a little bit of definition about fetal alcohol syndrome. So FAS is due to alcohol abuse during pregnancy. And some clinical assessment includes microcephaly, small palpebral fissures. Those are in the eyelids, abnormally small eyes, maxillary hypoplasia, epicanthal faults. Those are faults of skin of the upper eyelid over the eye, thin upper lip, and those sometimes might disturb vision. Then you've got thin upper lip, short upturned nose, and those are the facial deformities that we talked about. And then you've got altered palmar, crease pattern, short birth length, low birth weight, narrow forehead, mental retardation, and lastly, cardiac defects. Listen, I cannot put all those Google images on this slide, so make sure you just stop this video, go to Google, and search images about every symptom of those, all right? Just have an idea. All right, let's move to the next question. The nurse provides care to a newly diagnosed patient with schizophrenia. And oh my God, this is the first time we're gonna talk about psych disorders. Are you excited? Yes, of course. So we're gonna talk about schizophrenia, and then we're gonna talk about some medication, psych medication that is related to this mental disorder, all right? You're gonna love it. It's gonna be direct to the point. If you don't like psych or psychology, listen, I know, all right? I've been in your shoes. All my students have been in your shoes, but after the session or the subsequent episodes that we're gonna watch, I don't put everything in one episode because, listen, your brain will get jammed. I know that. So we're gonna discuss all psych disorders, but on different episodes so that you can learn them bit by bit, all right? So let's read the question again. The nurse provides care to a newly diagnosed patient with schizophrenia who is prescribed chlorpromazine, 25 milligram PO/TID. PO is per os or by mouth. TID is 3 times a day. Which patient's statement indicates a correct understanding of taking the medication? Select all that apply. And now I'm gonna read it a second time, and then we're gonna pick up keywords. Listen, every time you practice, it's gonna become easier and easier, and you will be able to select keywords properly. Anytime you have a disease, keyword. Anytime you have a sign and symptom, keyword. Anytime you have a medication, keyword. It's easy. All right, let's read the question again. The nurse provides care to a newly diagnosed patient with schizophrenia. Yes, schizophrenia is a keyword. Who is prescribed chlorpromazine, 25 milligram PO/TID. So chlorpromazine is a keyword. Which patient's statement indicates a correct understanding of taking the medication? Listen, I'm focusing on a correct understanding, which means the true statements. All right, if I want to rephrase the question in my own head, this is how I would do it. For visualize myself in a psych unit. Have you ever been to a psych unit? If not, maybe you check a YouTube video, alright? I visualize myself in a psych unit. Newly diagnosed schizophrenia patient. Newly diagnosed, brand new. I just gave teaching. And the doctor prescribed chlorpromazine. Then I want to check if the patient understands, what I taught him. So the patient's gonna tell me a few stuff, and I want to see which is the correct statement by the patient. What are the things he's saying right? That's what I'm gonna pick. Since this question is select all that apply, so I'm gonna treat it as true or false, okay? Let's read the options. I'll brush my teeth 3 times a day. Is this a true statement or not? Yes, this is true. Chlorpromazine has a side effect of dry mouth. So I need to keep oral hygiene and brush my teeth 3 times a day. The second option, 4 to 6 weeks for my medication to start working. Yes, this is true. Chlorpromazine is an antipsychotic from a family called phenothiazines. So this drug class takes at least 4 to 6 weeks to start seeing some improvement and some relief in symptoms. Option number 3, I may have a glass of wine each night because it is good for the heart. Listen, I don't know what your doctor told you, but never ever mix drugs and alcohol, especially on the NCLEX. This is the ideal world, right? Option number 4, I can drive myself to work on Monday. Again, listen, I don't care what your doctor told you, but do not operate heavy machinery, which is cars. Do not operate heavy machineries if you are on antipsychotics. Option number 5, I have to get blood levels regularly for a couple of months. Yes, this is true because chlorpromazine has an effect on white blood cells and it causes leukopenia. So I need to check labs routinely for the first at least 3 months. And then you've got option number 6, I will not worry about pink urine. And this is true because with chlorpromazine, you will have pink urine. It is a known side effect that causes no harm, so tell the patient not to worry about it. And if the patient said so, yes, that's a true statement. I'm gonna select this option. So the right options are 1, 2, 5, and 6. All right, now let's talk a little bit about schizophrenia. Schizophrenia is a challenging psychotic disorder that often makes it difficult to distinguish between what is real and what is unreal. To think clearly, manage emotions, relate to others, and function normally. It affects the way a person behaves, thinks, and sees the world. Signs and symptoms of schizophrenia are delusions, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. And listen, I know what you're thinking. You're saying, Mo, what is the difference between delusions and hallucinations, illusions, and negative symptoms, positive symptoms? I don't want you to worry about anything. I'm gonna explain everything to the T. Remember, we will leave no stone unturned. So I want you to put your feet in cold water. Is that an expression or I'm just translating from Arabic into English? I'm not sure. Maybe I am. All right, let's first talk about delusions. A delusion is a firmly held idea that a person has despite clear and obvious evidence that it is not true. Delusions are extremely common in schizophrenia, occurring in more than 90% of those who have this disorder. Often these delusions involve illogical or bizarre ideas or fantasies. There are 4 main kinds of delusions. Alright, listen, there are more than 4 kinds of delusions, but you don't need those for your NCLEX. You're not doing a psychology major, alright? So I'm going to teach you the 4 kinds that you need for your NCLEX and make sure you master those. The first kind is delusion of reference. The second kind is delusion of grandeur. Then delusion of jealousy. And lastly, delusion of persecution. First, let's talk about delusions of reference. This is a neutral environmental event which is believed to have a special and personal meaning. A very popular example is when a patient might believe a billboard or a person on TV is sending a message meant specifically for them. Delusion of grandeur is a belief that you, which is the patient, is a famous or important figure, such as Jesus Christ or Napoleon, for example. Alternately, delusions of grandeur may involve the belief that you have unusual powers, such as the ability to fly. For example, a patient might dial 444-4444 and asks for his fiancée. And he might say something like this, hey, Can I speak to my fiance, Jessica Alba? Hey, in your dreams, buddy. Your fiance is Jessica Alba? Alright, moving on. Delusions of jealousy. A person with this type of delusional disorder believes that his or her spouse or sexual partner is unfaithful without having any real proof. Delusions of persecution is the belief that others, often a vague they, this could be CIA or the mob or a gang in LA or something that, are out there to get you. These persecutory delusions often involve strange ideas. For example, a patient is very agitated. He believes that the CIA has taped the phone and they are sending messages through the television, and that you, which is the patient, are an agent who has been planted by the agency. Alright, some weird ideas. Now let's talk a little bit about hallucination. Hallucinations are sounds or other sensations experienced as real when they exist only in your mind. Schizophrenic hallucinations are usually meaningful to the patient experiencing them. Many times, the voices are those of someone that the patient knows, and usually they are critical, vulgar, or abusive. Visual hallucinations are also relatively common, but mostly not harmful. An example of visual hallucinations: sometimes you see a patient with schizophrenia in a nursing home looking out of the window and he's saying, "Oh my God, isn't the snow beautiful? Like, it's snowing, isn't it beautiful?" And it would be like in the middle of the summer and humidity is like unbearable. You know what I mean? Alright, auditory hallucinations are the most popular type of hallucinations. The patient might be hearing voices. Sometimes he'll tell you the voice is coming from inside my head, or sometimes he will tell you I'm hearing voices from the outside. It could be multiple voices, like voices talking to each other and he's just listening to the conversation, or voices talking to him. And most probably those voices are not cool. They're not kind. They are abusive. They are telling him to do things like, suicide, harming himself, harming other people. So auditory voices are the most common type of hallucinations. Now let's talk a little bit about disorganized speech. Schizophrenia can cause you to have trouble concentrating and maintaining a train of thought. You might respond to queries with unrelated answer. You might start a sentence with one topic and end somewhere completely different. You might be speaking incoherently or say illogical things. Common signs of disorganized speech include loose associations, which is rapidly shifting from topic to topic, with no connection between one thought and the next. Neologism, those are made-up words or phrases that only have a meaning to the patient himself. Perseveration, which is the repetition of words and statements, where the patient will be saying the same thing over and over. And lastly, you've got clang. Those are meaningless use of rhyming words, like a patient is rapping. For example, I said the bread and read the shed and fed Ned at the head. It means nothing, but it's just the patient saying rhyming words as if he's rapping. Now let's talk about disorganized behavior. Schizophrenia disrupts goal-directed activity, impairing your ability to take care of yourself, your work, and interact with others. Disorganized behavior appears as a decline in overall daily functioning, unpredictable or inappropriate emotional responses, behaviors that appear bizarre and have no purpose, lack of inhibition and impulse control. Now let's talk about negative symptoms. Those so-called negative symptoms of schizophrenia refer to the absence of normal behaviors found in healthy individuals, such as lack of emotional expression. Those are inexpressive face, or sometimes they call it a poker face, including a flat voice, lack of eye contact, and blank or restricted facial expressions, lack of interest or enthusiasm. Those are problems with motivation and lack of self-care. And then you've got lack of interest in the world, which shows through apparent unawareness of the environment, and the patient will be socially withdrawn. Lastly, you've got speech difficulties and abnormality, which is the inability to carry a conversation. The conversation will be short and sometimes disconnected replies to questions. The conversation most probably is short and sometimes disconnected replies to questions. And those patients speak in monotone. Now let's talk a little bit about the treatment for schizophrenia. The most effective treatment strategy for schizophrenia involves a combination of medication, therapy, lifestyle changes, and social support. Let's talk about medication and some antipsychotic drugs. One of the most important antipsychotic antipsychotics are phenothiazines. Some of the most popular medication that you will see on your NCLEX included in this family class are chlorpromazine, triflucopyrazine, thioridazine, terfenazine, triflupromazine, and lastly L'Occitane. Some of the side effects of phenothiazines are drowsiness and orthostatic hypotension. Listen, maybe I didn't explain it in previous episodes, but I've been getting messages about it, so let me explain it. Orthostatic hypotension is the change in blood pressure when you change levels. Let's say you're in a supine position and you check blood pressure and it's 120/80. Then the patient sits up on the side of the bed and then you check the blood pressure and it drops to 90/60. Alright, what is this called? It's called orthostatic hypotension. Alright? And then the second side effect is anticholinergic effects. Examples of anticholinergic effects are dry mouth, blurred vision, urinary retention, and constipation. And then you've got weight gain. Then extrapyramidal effect, pseudo-Parkinsonism, akathisia, dystonia, tardive dyskinesia. And then 5, you've got photosensitivity. Photosensitivity is usually sensitivity to sunlight. Sometimes the skin changes colors, maybe it gets strained or maybe red a little bit, maybe the color of the eyes change, but without any visual impairments. And then you've got blood dyscrasias. And lastly, you've got neuroleptic malignant syndrome. And it has signs like high fever, tachycardia, tachypnea, severe muscle rigidity, which is a life-threatening emergency. Now let's talk about the nursing care and patient teaching. It takes around 4 weeks to reach therapeutic effect. The patient should lay down 1 hour after taking the medication and get up slowly because of orthostatic hypotension. Of course, patients should avoid alcohol, any sedatives, and antacids because they reduce absorption of the drug. And then monitor for extrapyramidal effects. Fluphenazine is a phenothiazine that is given to patients who are non-compliant because fluphenazine can be administered IM, which is intramuscular, once every 14 days. Now let's talk a little bit about non-phenothiazines. The drugs under this class are haloperidol, thiothiazine, and pimozide. Side effects may include severe extrapyramidal syndrome, leukocytosis, blurred vision, dry mouth, urinary retention. And again, blurred vision, dry mouth, and urinary retention are signs of anticholinergic effect. Now, nursing care and patient teaching, a patient should always avoid alcohol and operating heavy machinery like driving cars or motorcycles. Now, let's talk about atypical antipsychotics. Drugs in this family are risperidone, olanzapine, quetiapine, aripiprazole, ziprasidone, and clozapine. Side effects that you're gonna see for those drugs, and we're gonna talk about every single drug of those. We're gonna start with risperidone, NMS, which is neuroleptic malignant syndrome. As we said, high fever, tachycardia, tachypnea, severe muscle rigidity. And then you've got extrapyramidal syndrome, you've got dizziness, GI symptoms, which is gastrointestinal symptoms like nausea and constipation, and then anxiety. Olanzapine has side effects of drowsiness, dizziness, extrapyramidal syndrome, and agitation. Quetiapine has side effects of drowsiness, dizziness, headache, extrapyramidal syndrome, weight gain, and anticholinergic effect. Clozapine has side effects of agranulocytosis, drowsiness, dizziness, GI symptoms, and neuroleptic malignant syndrome. Nursing care and patient teaching for those drugs are monitor white blood cells count weekly for the first 6 months, then bi-weekly. Monitor symptoms of neuroleptic malignant syndromes and EPS. Change position slowly because of orthostatic hypotension. With quetiapine, monitor lipid profile, especially for obese, diabetic, and hypertensive patients. Now we've got anticholinergics. Drugs in this family are benzotropine mesylate and amantadine. Side effects could be dry mouth, blurred vision, tachycardia, nasal congestion, constipation, urinary retention, and orthostatic hypotension. Nursing care and patient teaching for this drug class is to encourage sips of water, especially for dry mouth, chewing sugarless gum or hard candy. Increase fiber in diet, change position slowly to avoid dizziness, and report urinary retention to your physician. Now let's talk a little bit about some medical terminology that we went over. Blood dyscrasias is agranulocytosis and thrombocytopenia, which is low granulocytes and low platelets. Photosensitivity, and as we said, this is sensitivity to sunlight. Exposed skin turns blue and color changes in the eyes without causing vision impairment. And then neuroleptic malignant syndrome are symptoms of high fever, tachycardia, stupor, tachypnea, severe muscle rigidity, which is a life-threatening emergency. Serotonin syndrome is characterized by confusion, disorientation, and autonomic dysfunction. Now, autonomic dysfunction is a dysfunction of the nerves that regulate non-voluntary body functions, such as heart rate, blood pressure, and sweating. All right, listen, that's all you need to know about schizophrenia. I hope it was clear. If not, just go back, rewind it, and watch it again. And make sure you take notes, put everything in my notes for easy access. But now you know definition of schizophrenia, signs and symptoms, the drug being used, nursing care, and some patient teaching. So make sure you know all that. And with every single psychotic disorder, we're gonna discuss the same thing. All right, listen, this brings us to our last slide of the episode. And you know this is my favorite slide. And today, I do not have a quote for you. Actually, it is kind of a quote, but I have something else. I have a picture. I just snapped the picture. And let's see the picture. All right, that's me. Mindset is everything. And then you see the painting, which is right here. Mindset is everything. And then you've got a golden fish that has a shark, you know, whatever you call that thing. But listen, I'm not sure about you, but sometimes you might look in the mirror and say, hey, I'm just average. I'm not special. You're wrong. If you are a golden fish and you look in the mirror and you see a golden fish, something is wrong. If you look in the mirror and you see a shark, you are on point. Listen, this is what I want you to do. I want you to close your eyes. Literally, just do it with me. Just hear my voice, do this exercise with me. Just close your eyes and visualize the best version of yourself standing right there by your side. The best version of yourself standing right there by your side. Six-pack, healthy, lovely skin, right there by your side. Wealthy, millions of dollars. You've got the best car you dream of. Ferrari, Lamborghini, or Cadillac, it doesn't matter. Just imagine that person who is you, the best version of you standing by yourself, who has all those things, who has a beautiful family, a lovely career. He's dressed up like he's sharp or she's sharp. Just imagine the best version of yourself. Look at myself. I'm wearing a suit. I'm wearing a white shirt. I look sharp. I'm shaved. Oh my God. This dude is so beautiful. Just visualize that person by your side. High heels, looking sharp, wearing jewelry. Just visualize that person. I'm telling you, visualize that person by your side. The best version of yourself. Best version of yourself. And listen, this is what I want you to do. I want you to freaking stand up. Just stand up. And I want you to take a step to where you visualize that person. Just take a step to where you visualize that person. That's who you can become. That's who you are. You are a shark. You're not a goldfish. Let's make this happen. Love your face. See you on the next episode.
Hey, I hope you enjoyed episode number 9. It's a big deal. Episode number 9 is a big deal. But listen, before we move forward, I would like to ask you a quick question just to make sure that you are retaining the information. All right, which of the following is not, listen, which of the following is not an anticholinergic effect? You've got dry mouth, blurred vision, diarrhea, and urinary retention. Correct, of course, you are 100% right. Diarrhea, actually, anticholinergic effect. One of them is constipation and not diarrhea. So I'm glad that you have memorized those definitions. It's very important. They are very common on the NCLEX. All right, let's move on to episode number 10. I've got an amazing things in store for you and can't wait for you to start that episode. Let's go.
Y una para los dientes, ¿no?
No, solamente vino eso.
No vino la para lavarse los dientes, una caja de lavarse la boca. Sí. Oh.
Bueno, lo tienen aquí, ya dice, cuando tú quieras vienes y recoges.
Está bien. Mañana, ¿como a qué hora te recojo para ir a comer?
No, vamos a ir al cementerio para llevar una florecita afuera.
¿A qué hora?
Bueno, como a las 11 más o menos.
Tan tarde.
10:30, a las 10:30 más o menos, 10, a las 10 más o menos ir al cementerio y de ahí vamos.
Y mi abuelo va a ir con nosotros, ¿no?
Bueno, yo no sé, porque él está, tú sabes, con el ojo este, que él no puede estar por ahí cogiendo cosas y eso, tiene el ojo tapado y eso. Vamos a ir tú y yo, no, abuelo.
Pobrecito, mija. Él
Mira,
nunca.
él no puede, no puede.
Mami. Pregúntale a ver qué es lo que quiere hacer. El ojo, él puede hacer todo lo que él hace. No tiene nada. Pero él nunca sale a ningún lado. No tiene ningún problema que salga a comer. Para aquí, para allá no, él. Y todos los días no tiene que descansar y hacer reposo.
Pero tiene que tener ese ojo tapado ahí, hay muchas cosas allá afuera, y cosas de esas, y virus y cosas de esas, no, mira, no. Déjalo tranquilo. Cuando él se mejore de aquí a esto, bueno, al día de los padres se le lleva a comer.
Pobrecito.
No complique, no.
pobrecito, que esté encarcelado ahí.
No, déjalo tranquilo ahí. Vamos,
Nada más sale cada vez que va a los apoyos.
pues, está bien. Bueno, está bien. Nos vemos mañana entonces. ¿A las 10 vas a estar aquí?
Yo creo que mejor, bueno, don Ramón abre a las 11. Déjame ver a qué hora
Empieza
abre.
primero ir al cementerio.
Yo
mija.
sé, pero por esa razón quiero saber a qué hora abre don Ramón para ir cuando abre.
A las 11 más o menos creo. Samantha, mira a ver, cuando venga trae unas florecitas plásticas, porque yo lo que tengo aquí son flores de... Mira a ver si ahí en el dólar hay algunas florecitas plásticas a llevar. ¿Me estás oyendo?
Claro.
Pasa por el Dollar Tree y solo por un dólar. ¿Tú sabes dónde hay un Dollar Tree? Ahí al lado del City Train.
Ujú.
¿Tú sabes dónde está City Train? Ahí pasa
Sí,
por
sí.
ahí, entra y compra unas florecitas plásticas. ¿Me oíste? Que yo antes rato, hace días, yo iba a comprar, pero yo bueno, vamos a esperar que el café, que está como, que siempre está...
Está bien, entonces a las 10 voy a recogerte. Para
Ok, está bien.
eso voy a salir de aquí a las 9:30.
Está bien, tú traes a los niños.
No sé si los lleve, pero lo más seguro voy a ver porque no quiero, si Junior está durmiendo, no quiero dejárselos aquí. So, posiblemente los lleve.
No importa, trae, está bien.
Y a ver si después que vayamos al cementerio, vamos a comer. No sé si, yo me imagino que Junior va a ir, no creo que vayamos nosotras solas. Porque ya yo le dije, sí, no, a don Ramón.
Ah, está bien que vaya, no importa.
O como quieras tú, porque yo le dije a él que,
No, sí, sí, que vaya, que vaya. Si él nunca sale con nosotros, ¿verdad? Yo creo que el año pasado él nos sacó a comer.
no,
No importa.
no, el año pasado fuimos nosotras solas. Él se quedó con los niños. Creo.
Ah, bueno.
O el antepasado, no sé si es el año pasado. Yo me acuerdo cuando hicimos lo del video.
A comer o yo no sé si fue el día de tu
No, yo me acuerdo porque fue el video que hicimos, el video de todo.
No, que fue cuando, pero fue a Apple.
Nosotros fuimos el Día de las Madres, fuimos a Texas, a Texas ese.
No, a Apple. Otro día